Court reporter check 1, 2, 3, 4. Court reporter check 5, 6, 7, 8. Court reporter check 5, 6, 7, 8, 9, 10. 10, 9, 8, 7, 6, 5, 4, 3. Court reporter check 5, 6, 7, 8, 9, 10, 11, 12. 5, 6, 7, 8.
Mr. Pallone. Mr. Chairman.
What's that? The Subcommittee on Health will come to order. Today, the subcommittee will consider 16 public health bills, and these include H.R. 758, the Pediatric Research Consortia Establishment Act, H.R. 1032, the Heart Disease Education, Analysis, Research, and Treatment for Women Act, H.R. 1230, the Bone Marrow Failure Disease Research and Treatment Act of 2009, H.R. 1347, the Concussion Treatment and Care Tools Act of 2009, H.R. 1362, the National MS and Parkinson's Disease Registries Act, H.R. 1995, the Eliminating Disparities in Diabetes Prevention, Access, and Care Act of 2009, H.R. 2408, the Scleroderma Research and Awareness Act, H.R. 2818, the Methamphetamine Education, Treatment, and Hope Act of 2009, H.R. 2941, Johanna's Law Reauthorization, H.R. 2999, Veterinary Public Health Workforce and Education Act, H.R. 5354, the Gestational Diabetes Act of 2009, or GEDI Act, H.R. 5462, the Birth Defects Prevention, Risk Reduction, and Awareness Act of 2010, H.R. 5986, the Neglected Infections of Impoverished Americans Act of 2010, H.R. 6012, to direct the Secretary of Health and Human Services to review uptake and utilization of diabetes screening benefits and establish an outreach program with respect to such benefits and for other purposes. H.R. 6081, the Stem Cell Therapeutic and Research Reauthorization Act of 2010, and H.R. 6109, Health Data Collection Improvement Act. Pursuant to Committee Rule 9, the Chairman and Ranking Members will have 3 minutes each for opening statements, and any other subcommittee members who wish to make an opening statement will have 1 minute, and I'll recognize myself for 3 minutes. At the end of the last work period in July, Ranking Member Shimkus and I discussed my interest in advancing a number of bills that members of this committee had exhibited great leadership and interest in, and it's fair to say that in July there wasn't a great deal of agreement on the bills before us today. But I'd like to thank Ranking Member Shimkus and his staff's willingness to work with the majority over the past 7 weeks on how to amend the legislation so that we could move forward on a bipartisan basis. And I'm proud to report that we've reached agreement on almost every bill that we're going to consider today, and this is a result of a great deal of compromise and thoughtful work by both sides of our committee. One bill which we've not yet come to consensus on is H.R. 1210, the Arthritis Prevention, Control, and Cure Act of 2009, a bill with nearly 180 bipartisan co-sponsors. As many of you know, the author of this bill, Representative Eshoo, is out of town due to a death in her family. And with the support of Representative Eshoo, as well as the minority, we've decided to suspend consideration of H.R. 1210 until next week when we have our full committee markup. Now, I think all of you know I don't like to go outside of regular order, but the extra time will allow interested members, including the bill sponsor, to fully participate in any changes to the legislation. So it's one of these cases where it's going to go to the full committee without being marked up in subcommittee. So I appreciate our ranking members, Shimkus and Barton, for their accommodation of Representative Eshoo's unavoidable absence from the markup. The legislation that we are considering today encompasses a broad number of public health priorities that will strengthen and enhance research related but not limited to pediatrics, heart disease, multiple sclerosis, scleroderma, diabetes, bone marrow failure, and cancer. And I'm particularly pleased by the agreement we've made with the minority on the public health workforce legislation related to public health veterinarians that work in fields related to human health. Veterinary medicine is a critical component of our public health system, as veterinarians protect human health through early detection and response to infectious diseases. The revised legislation will ensure that veterinary public health professionals are eligible for 2 important public health workforce programs. So I wanted to particularly mention that, and again thank Mr. Shimkus and his staff, and yield to Mr. Shimkus.
Thank you, Mr. Chairman. As you mentioned, today's markup focused on a variety of health care bills. and a good portion of the bills have found agreement on both sides of the aisle. I do want to thank you, along with Chairman Waxman and your staff, for working to be able to move these bills. It is in a tough environment, in a very charged atmosphere. It's great to see that there are good relationships across the aisle and good faith efforts being made, and I'm sincere about that. Our problems are, as was noted yesterday, authorizing levels when you can't spend without authorization. If people are concerned about the growth in government, how can you continue to authorize? And then if you're authorizing, how much do you authorize? We've had that fight. That authorizations don't matter because the appropriations will have to follow. So why even fight the fight on authorization numbers? And if it's a $100,000 authorization, why not make it $2 billion if it doesn't really matter in the whole battle of the debate? We think it does, and we think that as I mentioned yesterday, we're going to have to start getting to a point where we offset the authorizations, where we start saying, if we're going to authorize new programs, we've got to find programs that are no longer in use that are being authorized, and try to get control of this out-of-control government spending. Although, again, we've been very happy. Our ability to expeditiously move this bill and negotiate over 6 and 7 weeks also points to the fact that we still patiently await for a hearing on the new health care law. We continue to ask for the committee to help us ask Secretary Sebelius to come forward to help look at the good, the bad, and the ugly of the health care law. We know things that were promised are not going to be delivered. We're going to have higher rates. We're going to have more deficit spending. We're going to have decrease in services. And the public would like to see us move in correcting some of the inequities we have created through the health care law. We do have challenges on one bill being brought forth today that will be debated and fought in regular order. Other than that, we expect all the other ones to be voice voted based upon the conscientious work on both sides. Mr. Chairman, with that, I'll yield back the balance of my time.
Thank you. Next in order of seniority is the gentleman from New York, Mr. Engel.
Thank you, Mr. Chairman. Thank you for holding this markup today on these important public health bills. I'm particularly grateful that we will be considering my bill, the Gestational Diabetes Act, today. As the sponsor of this bill, I'm thrilled that we have the opportunity to move it one step closer and being enacted into law. I want to thank my friend Dr. Burgess for being with me every step of the way on this bill. This is truly a collaborative effort and a bipartisan effort. This legislation aims to target resources specifically at gestational diabetes, which has traditionally received far less attention and fewer resources than other types of diabetes. Yes, yet it is a disease that affects between 2 to 5% of pregnant women and can have severe long-term implications for both mother and child. Mr. Chairman, again, I'd like to thank my colleague, Dr. Burgess, for partnering with me, and I want to thank the committee staff on both sides of the aisle for their input and efforts on behalf of this legislation. I look forward to supporting the bills that my colleagues have introduced and are coming before us today. And I thank you again, Mr. Chairman, for holding this markup, and Mr. Shimkus as well. Thank you. I yield back.
Thank you, Mr. Engel. Next, again in seniority, is Mr. Burgess.
Thank you, Mr. Chairman. We're doing several bills today. 3 I will mention because I have worked very closely with their authors on the other side for months, and our staffs have worked for months improving the bills, making them better, more targeted, more responsive to the public health issues that need to be addressed. I firmly believe that a national surveillance system is created under H.R. 1363, the National Neurologic Disease Surveillance Systems Act of 2010, will be a critical step in allowing our researchers to access information that could be the key to solving several neurologic diseases. Gestational diabetes is a problem that's growing, and we don't really understand why. Unlike type 2 diabetes, gestational diabetes, while it can be related, is a very different issue requiring a unique approach. Finally, as an OB-GYN, I've been impressed with the work of the Pregnancy Risk Information Services. These organizations provide vital information to physicians and women to ensure a healthy pregnancy. HR 5462 provides support for evidence-based information regarding exposure-related risk. Resources are provided to increase the chances of a healthy pregnancy. I'd just like to go on record of support of these bills, and each address a specific public health need and will be very helpful to the country. I'll yield back.
Thank you. Yield to the gentleman from Texas, Mr. Green.
Thank you, Mr. Chairman, for holding the markup today on several pieces of health legislation pending for the committee. I'm a strong supporter and co-sponsor of many of the bills, and I'm glad we're moving them through the process. I've particularly been working with Representative Hank Johnson and Representative Gingrey on H.R. 5986, the Neglected Infections of Impoverished Americans Act of 2010. I'd like to thank them for their efforts on this issue. And, Mr. Chairman, I'd like to place the remainder of my statement into the record and yield back.
Well, that objection is so ordered, and any member of the subcommittee is welcome to submit their statement for the record without any further ado. Recognize the gentleman from Georgia, Mr. Gingrey.
Mr. Chairman, thank you. My time is brief, obviously, and I have a lot of people I want to thank. I'm a very proud co-sponsor of H.R. 5986, the Neglected Infections of Impoverished Americans Act of 2010. While I would like to commend all of the bill sponsors for advancing this issue, I want to single out my fellow subcommittee member, Congressman Green, and the bill sponsor, Hank Johnson, for their efforts in particular. As a medical provider for nearly 30 years, I've seen firsthand the debilitating impact that parasitic diseases can have on our nation's children. Therefore, I appreciate the support of my colleagues to advance our nation's understanding of these many parasitic diseases. I also want to signal out Clay Allsbach and Ryan Long of Mr. Barton's staff, as well as the staff of Mr. Shimkus and Mr. Waxman, for working with me to ensure that large animal veterinarians have access to the loan forgiveness provisions that are contained in H.R. 2999. In my home state of Georgia, as well as many other states, large animal veterinarians are in short supply. This is an important change for many rural areas of this country and a necessary step to ensure the safety of our food supply. And with that, Mr. Chairman, I yield back.
Thank you. Next is the gentlewoman from Colorado, Ms. DeGette. She waves. Our ranking member of the full committee, Mr. Barton.
Thank you, Mr. Chairman. I'll be very brief. I want to thank you and Chairman Waxman for working with myself and ranking member Shimkus on these bills. We started with a list much larger than this. We've narrowed it down to 17 bills, of which on those 17, my understanding is we have consensus or almost consensus on 16 of the 17 bills. Most of these bills are bipartisan in that they have Republican and Democrat co-sponsors from this committee. There is one bill, H.R. 6019, the Health Data Collection Improvement Act, that I do not support, and I'm not aware that any Republican on the committee supports. I'll have a statement on that bill when it comes up. But on the other 16, we are generally supportive or totally supportive and do appreciate the subcommittee markup in a bipartisan fashion. With that, I yield back, Mr. Chairman.
Thank you, Mr. Barton. And we now recognize the gentlewoman from Wisconsin.
I'll waive my opening statement and reserve my comments for when the bills come up.
Thank you. I think that covers everybody as far as I can see, so we'll move to calling up the bills. And our first bill for consideration, the chair will now call up H.R. 758, the Pediatric Research Consortia Establishment Act. The clerk will report the title of the measure.
H.R. 758. Section 1, this act may be cited as the
Without
Pediatric
objection,
Research...
the bill will be considered as read and open to amendment at any point. Does any member seek recognition to offer an amendment? Okay.
Mr. Chairman?
Yes. Recognize the gentlewoman from Colorado.
I have an amendment at the desk.
Chair recognizes gentlewoman to offer an amendment in the form of an amendment in the nature of a substitute. The clerk will report the amendment as they pass them out.
Amendment in the nature of a substitute, H.R. 758, offered by Ms. DeGette.
Without objection, the amendment will be considered as read, and the chair recognizes Congresswoman DeGette to speak on the amendment.
Thank you so much, Mr. Chairman. Mr. Chairman, this amendment makes a couple of changes to the underlying bill, namely removing the requirement and instead authorizing the NIH to award grants, contracts, or cooperative agreements to support up to 20 national pediatric research consortia. It also makes the establishment of the consortia and research subject to the availability of funds and focuses the efforts on unmet research needs. These are critical steps to ensure the health of America's children is receiving the support it deserves. About 20% of the U.S. population is in the pediatric care range, but only about 5% of NIH research funding is used to support pediatric research. The NIH has broad authority to do a lot of things under the Public Health Service Act, but we need to do more to focus on pediatric research. And within the existing Clinical and Translational Service Awards program, only Children's National Medical Center has been awarded a pediatric-specific grant. But outside of these CTSAs, not all institutions have a pediatric pillar within their research portfolio. And so, Mr. Chairman, this bill will stop pediatrics from having to compete with more prevalent adult research initiatives for resources. And while many smaller institutions are simply unable to compete for a CTSA, the Pediatric Research Consortia would be comprised of pediatric institutions of various sizes working together to provide important settings for research in childhood diseases. We've been working very, very hard with pediatric research institutions around the country on this bill for years, Mr. Chairman, and I'm really thrilled that we're bringing this bill up. I know that the children's hospitals and others are too as well. And so I appreciate all of the efforts at NIH to help organize this, and I think this legislation will be a great framework for pediatric research. And with that, Mr. Chairman, I'll yield back.
Thank you. Does anyone else wish to speak on Congresswoman DeGette's? Yes, Mr.
Chairman, just to say we appreciate my colleague and friend from Colorado and the work we've done, and it's good to move forward. And this is an example of when we have to fight for funds. This would be a good one for the appropriators to fight for. Yield back.
Thank you, Mr. Shimkus. Any other members seek recognition on the DeGette amendment? If not, there being no further discussion, the question is on the amendment by Representative DeGette in the nature of a substitute. All those in favor will signify by saying aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the amendment is agreed to. Now we'll move to vote. Has anyone? Well, I don't think anyone has another amendment, do they? No. Okay. So now move that the Subcommittee on Health forward H.R. 758, the Pediatric Research Consortia establish an act as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 758, the Pediatric Research Consortia Establishment Act as amended, is favorably forwarded to the full committee. Next bill is H.R. 1032, the Heart Disease Education, Analysis, Research, and Treatment for Women Act. The clerk will report the title of that measure.
H.R. 1032, a bill to amend the Federal Food, Drug, and Cosmetic Act and the Public Health Service Act.
Without objection, the bill will be considered as read and open to amendment at any point. Does any member seek recognition to offer an amendment? A gentlewoman from California, Ms. Capps.
I have an amendment at the desk.
Recognize our Vice Chair, Representative Capps, to offer an amendment in the form of an amendment in the nature of a substitute. Clerk will report the amendment and pass it out.
Amendment in the nature of a substitute to H.R. 1032 offered by Mrs. Capps.
Without objection, the amendment will be considered as read. The Chair recognizes Representative Capps to speak on the amendment.
Thank you, Mr. Chairman. And the amendment simply is a matter of discussion between amongst the members of the committee and it arrives at a very well constructed bipartisan compromise to get the language to be such as it is. And I appreciate the bipartisan cooperation on both sides of the aisle to make this a very good amendment to a good bill.
I thank our Vice Chair. Does any other member, Mr. Shimkus?
Yes, Mr. Chairman, just to concur with my friend from California, and our issues was making sure we did the study and also bringing in the authorization in line with what's close to what's been appropriated. So, and I appreciate her willingness to help us move forward. Yield back.
Thank you. Any other member want to comment on Ms. Kapp's amendment? Okay. If not, there be no further discussion. The question is on the amendment by Representative Katz, the nature of a substitute. All those in favor will signify by saying aye. All those opposed say no. Opinion of the Chair, the ayes have it, and the amendment is agreed to. Anyone else have an amendment? Okay, we'll move that the Subcommittee on Health forward H.R. 1032, the Heart Disease Education, Analysis, Research, and Treatment for Women Act, as amendment to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. In the opinion of the Chair, the ayes have it, and H.R. 1032, as amended, is favorably forwarded to the full committee. Next bill is H.R. 1230, the Bone Marrow Failure Disease Research and Treatment Act of 2009. Chair now calls up H.R. 1230, and the clerk will report the title of the measure.
H.R. 1230. This act may be cited as the Bone Marrow Failure Disease Research
Without
and
objection, the
Treatment
bill will
Act.
be considered as read and open to amendment at any point. The Chair would, I'm recognizing myself actually, to offer a manager's amendment in the form of an amendment in the nature of a substitute. The clerk will report the manager's amendment.
Amendment in the nature of a substitute to H.R. 1230 offered by Mr. Pallone.
Without objection, the manager's amendment will be considered as read, and I'll recognize myself on the manager's amendment and try to be brief. The amendment in the nature of a substitute makes a number of substantive and technical changes to the bill. The amendment streamlines the federal government's commitment to researching and treating acquired bone marrow failure diseases which occur when the body's bone marrow stops working properly. The amendment eliminates the proposed bone marrow failure registry at CDC, eliminates the proposed advisory committee on acquired bone marrow failure disease, and eliminates pilot studies at ATSDR. With these changes, the manager's amendment gives Health and Human Services the flexibility to determine where best to target resources related to research on acquired bone marrow failure disease. Many of us remember the late Representative Bob Matsui, husband to our colleague Doris, who passed away from acquired bone marrow failure disease, and I want to thank Representative Matsui for her thoughtful leadership on improving our understanding of acquired bone marrow failure disease, as well as her willingness to work with the Committee on Energy and Commerce and HHS on the legislation. Her contributions have been truly invaluable. Does anyone else wish to be recognized? Mr. Shimkus?
Just briefly, Mr. Chairman, thank you. Appreciate working together also on this, and I think this highlights the issue that we've given the Health and Human Secretary a lot of authority and a lot of discretion. So this is in line with what she can do based upon $15 billion of dollars in the new health care law to promulgate some of this stuff. So another way that we can be supportive, and I yield back.
Thank you. Any other member want to speak on the manager's amendment? Does any other member want to offer an amendment to the manager's amendment? Okay. If not, the question is on the manager's amendment in the nature of a substitute. All those in favor will signify by saying aye. All those opposed say no. Opinion of the Chair, the ayes have it, and the amendment is agreed to. Any other amendments to this bill? If not, I'll move that the Subcommittee on Health forward H.R. 1230, the Bone Marrow Failure Disease Research and Treatment Act of 2009, as amended, to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. Opinion of the Chair, the ayes have it, and H.R. 1230, as amended, is favorably forwarded to the full committee. Next is H.R. 1347, the Concussion Treatment and Care Tools Act of 2009. Now call up H.R. 1347. The clerk will report the title of the measure.
H.R. 1347, a bill to amend Title III of the Public Health Service Act.
Without objection, the bill will be considered as read and open to amendment at any point. I'll recognize myself initially for a manager's amendment in the form of amendment in the nature of a substitute. The clerk will report the manager's amendment.
Amendment in the nature of a substitute to H.R. 1347, offered by Mr. Pallone. Strike all after the enacting clause and insert
Without
the
objection,
following.
the manager's amendment will be considered as read, and I'll just speak on it initially. The Contact Act, as it's called, H.R. 1347, will help to reduce the number of concussion-related injuries nationally by improving the school's ability to guide return-to-play decisions and by raising awareness for parents, students, health professionals, and others of the consequences of multiple concussions. The substitute amendment makes the following changes to the original bill. First, it authorizes youth sport associations to be eligible for grants in addition to schools. Second, it allows rather than requires computerized testing as an eligible use of grants. Third, it requires the Secretary to make recommendations on how best to disseminate guidelines on sports-related concussions to the general public, including medical professionals and parents, rather than only to the schools. And lastly, removes all new authorization amounts. And I wanted to thank Mr. Shimkus and Mr. Barton both for their willingness to work on this bill with me and my colleague from New Jersey, Mr. Pasquale. I'm glad we could work out the details, and again, I thank both of you for your support. Does anyone else wish to speak on the manager's amendment?
Yes, Mr. Chairman.
Mr. Shimkus is recognized.
This was another example of us working together and understanding that there's current money available in the HHS budget, and along with the money that's available in that new health care law. It does allows the Secretary, she would be allowed but not required to award grants to states to help implement these guidelines, and then again the existing budget authority of the HHS. So I also want to recognize again a good friend of mine, Bill Pasquale, who's author of this bill, and Republican Todd Platts bringing this in a bipartisan manner to the committee, and I yield back.
Thank you, Mr. Shimkus. Does any other member want to speak on the manager's amendment? What did you say?
He said no.
Oh, no. Okay. Does anyone else want to offer an amendment to the manager's amendment? Okay. So there being no further discussion, the question is on the manager's amendment in the nature of a substitute. All those in favor will signify by saying aye. Somebody's got to say aye. Okay. All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment is agreed to. Any other amendments? Okay, if not, we'll move to the bill. Move that the Subcommittee on Health forward H.R. 1347 as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye.
Aye.
All those opposed, no. Opinion of the chair, the ayes have it, and H.R. 1347 as amended is favorably forwarded to the full committee. Next, H.R. 1362, the National MS and Parkinson's Disease Registries Act. Chair now calls up H.R. 1362, and the clerk will report the title.
H.R. 1362, a bill to amend the Public Health Service Act to provide for the establishment of permanent
Without
national
objection, the
surveillance.
bill would be considered as read and open to amendment. Does any member seek recognition to offer an amendment?
Mr. Chairman, I have an amendment at the desk.
Gentleman from Texas, Mr. Burgess is recognized to offer an amendment in the form of an amendment in the nature of a substitute. And the clerk will report the amendment and pass it out.
Amendment in the nature of a substitute to H.R. 1362, offered by Mr. Burgess of Texas.
Without objection, the amendment will be considered as read, and the chair recognizes Representative Burgess to speak on the amendment.
Thank you, Mr. Chairman. And speaking on the amendment in the nature of a substitute, I do want to acknowledge that there were a significant number of hours of work that went on in a bipartisan fashion on both sides, and certainly want to thank Ann Morris and Ray Thorne, as well as Ryan Long and J.P. Polskevich from my staff for their hard work on this bill. The manager's amendment eliminates the requirement that the Secretary establish two separate surveillance registries. Instead, the amendment provides the Secretary with the flexibility to collect data on neurologic conditions, including multiple sclerosis and Parkinson's. The amendment does not require the Secretary to establish a new advisory committee. Instead, the amendment directs the Secretary to consult with individuals with specified expertise. The amendment updates the authorization period from fiscal year 2012 through 2016. The amendment requires the Secretary to report to Congress on the implementation of the bill. And finally, the amendment updates the bill to more accurately reflect the bill's activities. And then I'd like to submit formal comments on the underlying bill for the record, but just a word on the underlying bill that the legislation will emphasize the study of the epidemiology of neurologic diseases. It's vital that we examine the previous trends in disease as they relate to geography, environmental factors, and heredity to forecast future trends. And in order to advance, we must create a foundation for research. Now I'll yield back the balance of my time.
Thank you. Mr. Burgess's written or additional statement will be considered for the record, will be entered into the record. Does any other member seek recognition to speak on the Burgess amendment? Okay. Any other members seek recognition or offer an amendment to the amendment? Guess not. If not, there being no further discussion, the question is on the amendment by Representative Burgess in the nature of the substitute. All those in favor will signify by saying aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the Burgess amendment is agreed to. And unless there are other amendments to this bill, we'll move to vote on the bill. And I move that the Subcommittee on Health forward H.R. 1362 as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it. And H.R. 1362 as amended is favorably forwarded to the full committee. Next bill is H.R. 1995, the Eliminating Disparities in Diabetes Prevention, Access, and Care Act of 2009. The chair calls up H.R. 1995. The clerk will report the title.
H.R. 1995, a bill to amend the Public Health Service Act.
Without objection, the bill will be considered as read and open to amendment at any point. Does any member seek recognition to offer an amendment? Gentlewoman from Colorado, Ms. DeGette.
I have an amendment at the desk.
Chair recognizes Representative DeGette to offer an amendment in the form of an amendment in the nature of a substitute. Clerk will report the DeGette amendment and pass it out.
Amendment in the nature of a substitute to H.R. 1995 offered by Ms. DeGette.
Without objection, the amendment will be considered as read. Chair recognizes the gentlewoman to speak on her amendment.
Thank you very much, Mr. Chairman. Mr. Chairman, what this amendment in the nature of a substitute does is essentially strike the bill and replace it with a study addressing the areas of focus from the underlying bill. In early July, we had a hearing in this subcommittee with the NIH and the CDC who talked about research and other public health efforts with respect to diabetes. And that hearing confirmed that minorities are disproportionately affected by diabetes. But what we've learned, both through that hearing and also through communications with the NIH and CDC, is that they are engaged in various efforts to reach these populations. NIH is working to increase minority population in its clinical research. CDC has evidence-based community initiatives to reduce the likelihood of diabetes among high-risk folks. And so it made sense to us as we looked at the legislation and we looked at these efforts that before we pass the legislation, we should study what's going on. And the amendment offers 4 areas to be evaluated: research, surveillance, and data collection, community-based interventions, and education and training of health professionals. If we can do this, then I believe this committee will gain a better understanding of NIH, CDC, and other agencies' efforts to address diabetes, and we can look and see if we need to move forward with more substantive legislation. That seems to be an appropriate way to proceed. And with that, I would ask my colleagues to support this amendment, and I would yield back.
Thank you. Does any other member want to comment? Mr. Shimkus?
Mr. Chairman, just to say we're supportive of the gentlelady from Colorado's amendment in her bill, and as she's the co-chair, probably chair of the Diabetes Caucus, and relentless in her work in this effort, and we applaud it and yield back.
Thank you. Any other member want to comment on the DeGette amendment? Okay. Then we'll move to the question on the amendment by Representative DeGette in the nature of a substitute. All those in favor will signify by saying aye. Aye. All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment, the DeGette amendment, is agreed to. And unless we have any other amendments, I'm going to move the bill. I now move that the Subcommittee on Health forward H.R. 1995 as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. Opinion of the chair, the ayes have it, and H.R. 1995 as amended is favorably forwarded to the full committee. Next bill is H.R. 2408, the Scleroderma Research and Awareness Act. The chair now calls up H.R. 2408. The clerk will report the title.
H.R. 2408, a bill to expand the research and
Without
awareness.
objection, the bill will be considered as read and open to amendment. Does any member seek recognition to offer an amendment? The gentlewoman from California, Ms. Capps.
I have an amendment at the desk in the nature of a substitute.
Chair now recognizes the Vice Chair to offer an amendment in the form of an amendment in the nature of a substitute. The clerk will report the amendment and pass it out.
Amendment in the nature of a substitute to H.R. 2408 offered by Mrs. Capps.
Without objection, the amendment will be considered as read. The chair recognizes Congresswoman Capps to speak on the amendment.
Thank you, Mr. Chairman. And this is the case that in bringing the bill to the committee and working with the Republican side, the minority side, we were able to agree upon the bill, and they made improvements to the bill, encouraging the NIH to conduct more research into scleroderma, which is a very positive contribution, and it as well encourages the CDC to conduct a public awareness campaign about scleroderma. We're happy that we've reached a consensus and agreement, and this is the nature of the substitute.
Thank you. Any other member want to comment? No? Okay. And I assume we have no amendments to the amendment, so we will move to the question on the amendment by Representative Capps in the nature of the substitute. All those in favor will signify by saying aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the Capps amendment is agreed to. Any other amendments? If not, I move that the Subcommittee on Health forward H.R. 2408, the Scleroderma Research and Awareness Act, as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 2408, as amended, is favorably forward to the full committee. Next bill is H.R. 2818, the Methamphetamine Education, Treatment, and Hope Act of 2009. The chair calls up H.R. 2818. The clerk will report the title.
H.R. 2818, a bill to amend the Public Health Service Act.
Without objection, the bill will be considered as read and open to amendment at any point. And I'll recognize myself to offer a manager's amendment in the form of an amendment in the nature of a substitute. The clerk will report the manager's amendment and pass it out.
Amendment in the nature of a substitute to H.R. 2818 is offered by Mr. Pallone.
Without objection, the manager's amendment will be considered as read, and I'll recognize myself to speak on it briefly. H.R. 2818, introduced by our committee colleague, Representative Jerry McNerney, is the Methamphetamine Education, Treatment, and Hope Act, or METH Act. It reauthorizes and updates HHS's programs for family-based substance abuse treatment, workplace education, and youth. An earlier version of this bill passed the House in the last session. The manager's amendment updates authorization years and modifies the clearinghouse and student requirement to align with existing SAMHSA programs. It sets fiscal year 12 authorizations at $16 million and allows for a 3% increase per year for the ensuing 4 years of authorizations. The bill and amendment have bipartisan support, and I thank my colleagues for working with us to find agreement on it. And I urge my colleagues to support the bill and the manager's amendment. Does any other member seek to speak on the manager's amendment? Mr. Shimkus?
Thank you, Mr. Chairman. Just that meth is a scourge all over the country, especially in rural America. Appreciate the movement to the women and also the outpatient aspects of this bill. This was another one in which we wanted to bring the authorization in line with reality on appropriations, and you guys helped us do that, and we appreciate it. Go back.
Thank you, Mr. Shimkus. Any other member want to speak on the manager's amendment or any amendment to the manager's amendment? If not, the question is on the manager's amendment in the nature of a substitute. All those in favor will signify by saying aye. All those in favor, opposed, I'm sorry, will say no. Opinion of the chair, the ayes have it, and the manager's amendment is agreed to. Unless there are any other further amendments, we'll move the bill. I now move that the Subcommittee on Health forward H.R. 2818 as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 2818 as amended is favorably forwarded to the full committee. Next bill is H.R. 2941, Johanna's Law Reauthorization. The chair now calls up H.R. 2941, and the clerk will report the title.
H.R. 2941, a bill to reauthorize and enhance.
Without objection, the bill will be considered as read and open to amendment at any point. And I'll recognize myself to offer a manager's amendment in the form of amendment in the nature of a substitute. The clerk will report the manager's amendment.
Amendment in the nature of a substitute, H.R. 2941, offered by Mr. Pallone.
Without objection, the manager's amendment will be considered as read, and we'll pass it out, and I'll recognize myself to speak briefly on it. The bill was introduced by Congresswoman Rosa DeLaura to reauthorize Johanna's Law, a CDC program to promote awareness and outreach of gynecological cancer. It also emphasizes evaluation of the effectiveness of new demonstration projects, and it has broad bipartisan support. The manager's amendment brings the proposed new demonstration projects into the main program and changes overall authorization amounts. It makes other minor technical changes and corrections to the bill. And I know that many of my colleagues here today are co-sponsors of the bill, and I urge your support for the bill and the manager's amendment. Does any other member seek recognition to speak on the manager's amendment? If not, does any other member want to offer an amendment to the manager's amendment? I don't think so. So the question is on the manager's amendment in the nature of the substitute. All those in favor will signify by saying aye. All those opposed say no. Opinion of the chair, the ayes have it, and the amendment is agreed to. Unless there are any other amendments, I will now move that the Subcommittee on Health forward H.R. 2941, Johanna's Law Reauthorization, as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. Opinion of the chair, the ayes have it, and H.R. 2941, as amended, is favorably forwarded to the full committee. Next is H.R. 2999, the Veterinary Public Health Workforce and Education Act. The chair calls up the bill. Clerk will report the title.
H.R. 2999.
Without objection, the bill would be considered as read and open to amendment at any point. Does any member seek recognition to offer an amendment? Recognize the gentlewoman from Wisconsin, the sponsor of the bill, Representative Baldwin, to offer an amendment in the form of an amendment in the nature of a substitute.
Thank you, Mr. Chairman.
We have to report the amendment and pass it out. And
all right, I would call up the manager's amendment. I have an amendment at the desk.
Thank you. The clerk will report the amendment.
Amendment in the nature of a substitute, H.R. 2999, offered by Ms. Baldwin.
Without objection, the amendment will be considered as read, and the chair recognizes Congresswoman Baldwin to speak on the amendment.
Thank you, Mr. Chairman. You and I have shared a longstanding interest in the public health veterinary workforce and a mutual concern that the capacity is simply not there to meet our public health needs. Also, Mr. Murphy, my friend and colleague from Pennsylvania, has picked up this mantle as well, and I want to share my sincere thanks to both of you for your time and effort. I will submit my longer statement for the record, but want to stress that over the next 20 years, experts predict a shortage of over 15,000 public health veterinarians, and they serve a critical role in protecting human health. This manager's amendment will clarify that the purview of the existing public health workforce grants and the public health loan repayment program includes veterinary public health. Thank you again, Chairman Pallone, for your work on the manager's amendment, and as well as the minority for diligently working with us on this. I urge my colleagues to support the amendment and yield back the balance of my time.
I thank the gentlewoman. Mr. Shimkus.
Thank you, Mr. Chairman. I want to thank a colleague from Wisconsin for her work in this area. The improvement in H.R. 2999 will ensure that food animal veterinarians are eligible for the loan repayments of those with food animal practices. We do fear that there will be a shortage of these type, and it will affect our food supply. So we appreciate the efforts and look forward to working as the bill goes forward. I yield back.
Thank you. Any other member would like to speak on the Baldwin amendment? Anybody have another amendment to the Baldwin amendment? If not, the question is on the amendment by Representative Baldwin in the nature of a substitute. All those in favor will signify by saying aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the Baldwin amendment is agreed to. Now, unless we have any other amendments, we're going to move to the bill. I now move that the Subcommittee on Health forward H.R. 2999, the Veterinary Public Health Workforce and Education Act as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. Aye. All those opposed say no. Opinion of the chair, the ayes have it, and H.R. 2999 as amended is favorably forwarded to the full committee. The next is H.R. 5354, the Gestational Diabetes Act of 2009. Chair calls up H.R. 5354. Clerk will report the title.
H.R. 5354, a bill to establish an advisory committee.
Without objection, the bill will be considered as read and open to amendment. Does any member seek recognition or offer an amendment?
Mr. Chairman, I have an amendment at the desk.
Chair recognizes Representative Engel to offer an amendment in the form of an amendment in the nature of a substitute. The clerk will report the amendment and pass it out.
Amendment in the nature of a substitute, H.R. 5354, offered by Mr. Engel.
Without objection, the amendment will be considered as read, and the chair recognizes the gentleman from New York to speak on his amendment.
Thank you, Mr. Chairman. I'm offering an amendment in the nature of a substitute to H.R. 5354, the Gestational Diabetes Act. This amendment will eliminate the creation of a new research advisory committee on gestational diabetes and instead instructs the CDC to work with the already existing Federal Diabetes Mellitus Interagency Coordinating Committee, or DMICC, to develop a multi-site gestational diabetes research project within the diabetes program to expand and enhance surveillance, data, and public health research on gestational diabetes. The amendment also updates the authorization years from FY 2010 through FY 2016. Mr. Chairman, I wanted to ensure that we were maximizing existing resources to accomplish our goals, which are to achieve a greater understanding on how to prevent and treat gestational diabetes, as well as identify new therapies and interventions to detect, treat, and slow the incidence of gestational diabetes, and ultimately prevent women afflicted with this condition and their children from developing type 2 diabetes. I believe that this amendment accomplishes that, and I urge my colleagues to vote in favor of it. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Engel. Anyone else? Gentleman from Texas, Mr. Burgess.
Thank you, Mr. Chairman. I'd ask unanimous consent that I can insert a longer statement into the record, but just briefly, I would add
So ordered.
Add to Mr. Engel's comments that there currently is an inefficient system for monitoring the cases of gestational diabetes to uncover trends and target at-risk populations. This legislation will promote public health research to understand the epidemiologic, environmental, and behavioral and translation biomedical factors that can influence the risk of gestational and type 2 diabetes. I believe this bill will allow us to strategically utilize the resources in conjunction with the states to effectively target at-risk populations that may have previously received little or no support. I'll urge passage of the bill and yield back my time.
Thank you, Mr. Burgess. Does anyone else want to speak on the Engel amendment or make an amendment to the Engel amendment? If not, the question is on the amendment by Representative Engel in nature of a substitute. All those in favor will signify by saying aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the Engel amendment is agreed to. Any other amendments to this bill? If not, I now move that the Subcommittee on Health forward H.R. 5354, the Gestational Diabetes Act of 2009, as amended, to the full committee with a recommendation that the bill pass. All those in favor will say aye. Aye. All those opposed say no. Opinion of the chair, the ayes have it, and H.R. 5354, as amended, is favorably forwarded to the full committee. Next bill is H.R. 5462, the Birth Defects Prevention, Risk Reduction, and Awareness Act of 2010. Chair calls up H.R. 5462. Clerk will report the title.
H.R. 5462, a bill to authorize...
Without objection, the
Secretary.
bill will be considered as read and open to amendment at any point. And I'll recognize myself to offer a manager's amendment in the form of an amendment in the nature of a substitute. The clerk will report the manager's amendment.
Amendment in the nature of a substitute, H.R. 5462, offered by Mr. Pallone.
Without objection, the manager's amendment is considered as read, and the clerk will pass it out. And I'll recognize myself briefly again on the manager's amendment. The bill provides accurate evidence-based clinical information to patients and healthcare professionals about exposures during pregnancy and breastfeeding. The substitute amendment makes the following changes to the original bill by first eliminating the national media campaign, second eliminating the research and surveillance sections, and finally reducing the authorization amounts by 0.5, I guess that's $500,000 for each fiscal year. And I want to thank my colleague from Connecticut, Representative DeLauro, for her leadership on this issue, but I also want to thank Mr. Burgess for his work on this bill as well. Does anyone else want to comment on this?
Mr.
Yes,
Chairman,
Mr.
again,
Burgess.
just briefly, and I would ask
Yes.
unanimous consent to insert a longer statement into the record.
So ordered.
This is an important topic and a worthwhile subject. Each year, over 70,000 women and healthcare providers seek information from pregnancy risk information centers. Unfortunately, many women and healthcare providers lack evidence-based clinical information about exposure risks and are unaware of the availability of counseling through the information services. You know, people go to their doctor and they think their doctor has all the answers. The doctors like to think that the CDC and the NIH has all the answers, but in fact, neither of those conditions is accurate. But through this legislation, we can promote the diffusion of accurate information while cutting healthcare costs and promoting healthy pregnancies, healthy mothers, and healthy babies. And I'll yield back.
Thank you, Mr. Burgess. Anyone else want to comment on the manager's amendment or seek an amendment to the manager's amendment? If not, the question is on the manager's amendment in the nature of a substitute. All those in favor will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the manager's amendment is agreed to. And unless there are further amendments, we'll move to the bill. I now move that the Subcommittee on Health, God bless you, forward H.R. 5462, the Birth Defects Prevention, Risk Reduction, and Awareness Act of 2010 as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. Opinion of the chair, the ayes have it, and H.R. 5462 as amended is favorably forwarded to the full committee. Next is H.R. 5986, the Neglected Infections of Impoverished Americans Act of 2010. The chair now calls up H.R. 5986. The clerk will report the title.
H.R. 5986, a bill to require...
Without objection, the bill will be considered as read and open to amendment at any point. Does any member seek recognition to offer an amendment? I don't expect anybody. Mr. Gingrey, did you? No?
Mr. Chairman, that was worked out, and working with Representative Johnson, very pleased that we were able to cooperate on that. I have no amendment at this time. I'm pleased with the bill.
Thank you. Would anyone else like to speak on the bill before we proceed? No? Okay. I now move that the Subcommittee on Health forward H.R. 5986, the Neglected Infections of Impoverished Americans Act 2010, to the full committee with the recommendation that the bill pass. All those in favor will say aye. Aye. All those opposed say no. Opinion of the chair, the ayes have it, and H.R. 5986 is favorably forwarded to the full committee. Next is H.R. 6012 concerning diabetes screening utilization. Chair now calls up H.R. 6012, and the clerk will report the title.
H.R. 6012, a bill to direct the Secretary of Health and Human
Without objection, the bill is
Services.
considered as read and open to amendment. Does any member seek recognition to offer an amendment? Gentleman from Ohio have an amendment? Mr. Space?
Thank you, Mr. Chairman. I have an amendment in the nature of a substitute at the desk.
Clerk will report the amendment and pass it out.
Amendment in the nature of a substitute to H.R. 6012, offered by Mr. Space.
Amendment, without objection, the amendment will be considered as read, and the chair recognizes the gentleman from Ohio to speak on the amendment.
Thank you, Mr. Chairman. I want to begin by thanking you and Mr. Shimkus for working together on this bill to address a real problem, and that is diabetes in our senior community. I also like to thank the staff for their cooperation and their tireless work on both sides of the aisle. Diabetes is obviously a problem that plagues this country in many ways, and virtually every demographic is affected by it. One of the many tragedies associated with diabetes is that oftentimes folks will be diagnosed or will have the condition and be undiagnosed. All too often we're seeing senior citizens showing up in emergency rooms with ulcerated foot or a failing kidney, suffering from type 2 diabetes, not even knowing that they have the disease. Oftentimes, these diagnoses come after the complications have begun to set in. And in the end, that compromises the quality of life in profound ways and creates, in many cases, unnecessary and enormous medical expenses. This legislation is designed to deal with that problem. The bill, which I introduced with the cooperation of my colleague from Nebraska, Mr. Terry, seeks to address that problem by requiring that HHS perform a study into the uptake and utilization of existing screening benefits available to the public, and also provide recommendations on how those benefits could better be made available. Of particular interest is a screening benefit available to Medicare beneficiaries that allows them to be tested for the presence of diabetes, which incidentally is a very, very low cost and efficient procedure. In this bill, we're really getting at the heart of one of the biggest issues in the diabetes community, and that is undiagnosed diabetics. I think this is a common sense approach to a very difficult problem. The text of this amendment, in the nature of a substitute, does not propose new authorizations or new authorities. Instead, we just want to make sure that we are using benefits already available. And with that, I'd like to thank once again our partners on both sides for working together toward creating legislation that could achieve the support of both sides. And with that, I yield back.
Thank you, Mr. Space. Does anyone else want to comment on the Space amendment? No? Or offer an amendment to it? No. Okay, the question is on the amendment by Representative Space in the nature of a substitute. All those in favor will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the Space amendment is agreed to. Unless we have any other amendments, which I don't think we do, I now move that the Subcommittee on Health forward H.R. 6012 as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. Opinion of the chair, the ayes have it, and H.R. 6012 as amended is favorably forwarded to the full committee. Next bill is H.R. 6081, the Stem Cell Therapeutic and Research Reauthorization Act of 2010. Chair now calls up H.R. 6081, and the clerk will report the title of the bill.
H.R. 6081, a bill to amend the Stem Cell
Without
Therapeutic...
objection, the bill will be considered as read and open to amendment. Does any member seek recognition to offer an amendment? Oh, I do. Okay. I have an amendment at the desk.
Amendment in the nature of a substitute to H.R. 6081 offered by Mr. Pallone.
Without objection, the amendment will be considered as read and is being passed out. I'll recognize myself. The amendment in the nature of a substitute makes minor changes to the bill. It fixes a drafting error related to the terms of the National Cord Blood Inventory contract between cord blood banks and HRSA, or HRSA. The correction will clarify that units are to remain listed on the National Registry for 10 years. The amendment also fixes a drafting error in the allocation of funding for the sibling directed donation demonstration project. Current law establishes the funding for this demonstration project not to exceed 5% of the amount appropriated for the NCBI in each of fiscal years 2007 through 9. The amendment clarifies this policy. Finally, the amendment incorporates a recommendation by HHS supported by stakeholders from the National Marrow Donor Program to ensure appropriate safeguards related to the main blood bank supply. I hope if that I hope that clarified it. If not, I'm not sure. But the bill has wide bipartisan support, and I urge my colleagues to support both the manager's amendment and the bill. Does anyone? Yes, Mr. Shimkus.
Mr. Chairman, just to this is a great program, the Bill Young Cell Transplantation Program and the National Cord Blood Inventory and the Advisory Council on Blood Stem Cell Transplantation. It's been a great success. Reauthorization will allow us to continue the good work we started in 2005, and it's really bone marrow donors and cord blood units. It's adult stem cells. We're all in on this one. Thanks for your good work. Yield back.
Thank you, Mr. Shimkus. Does anyone else want to speak on the manager's amendment? Okay, or offer an amendment to the manager's amendment? I don't think so. So the question is on the manager's amendment by the chair. All those in favor will signify by saying aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the manager's amendment is agreed to. Unless anyone else has an amendment, we'll move the bill. And the chair now calls up H.R. 6081, the Stem Cell Therapeutic and Research Reauthorization Act. I'm sorry. We're going to move the bill to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 6081 is favorably forwarded to the full committee. Now, the next bill is H.R. 6109, the Health Data Collection Improvement Act. Chair calls up H.R. 6109. The clerk will report the title.
H.R. 6109, a bill to amend the Public
Without
Health
objection,
Service
the bill
Act
be considered as read and open to amendment at any point. Does any member seek recognition to offer an amendment to this bill?
Mr. Chairman.
Who seeks recognition? Oh, yes.
Well, parliamentary inquiry.
Yes.
I wish to make a statement on this bill, and then at the appropriate time also offer an amendment or amendments to the bill. What is the procedure to make a statement?
I have no problem with your making a statement at this point. I'm sorry. Oh, officially, I guess you have to ask to strike the last word.
Mr. Chairman, I would ask to strike the last word.
The ranking member is recognized.
Thank you, Mr. Chairman. As we have seen this morning, on the 16 bills marked up so far, the minority and the majority has worked together in a bipartisan fashion, and we have had a very smooth markup, which you have handled very cordially and efficiently. On this bill, 6109, there is not bipartisan agreement. For the life of me, I do not see any reason at all to move this bill. It would require any individual who seeks services from any program offered by Health and Human Services to answer a number of questions concerning their sexual orientation and gender identity. While I would assume that most adults understand and know what their sexual identity and gender identity is, it is inconceivable to me that a child who is applying to a SCHIP program would even know what some of the terms mean, Mr. Chairman. So I am not sure what is the underlying reason to put this particular bill on the agenda, but whatever the reason, I would strongly encourage members of the minority to oppose and at the appropriate time support some of the amendments that myself and others may be offering. With that, Mr. Chairman, I thank you for your graciousness, and I would yield back.
Thank you. Yes, the gentlewoman, the sponsor of the bill, Representative Baldwin, is recognized.
I seek to strike the last word.
Yes.
Thank you. I also want to address some opening remarks to this bill, and I think in my opening remarks I will hopefully address every concern that Mr. Barton has just raised. But first of all, generally, I'm delighted to speak in support of H.R. 6109, the Health Data Collection Improvement Act. This bill is about collecting data, no more, no less. As my colleagues may know, almost no federal health survey or federal health program collects any data on sexual orientation or gender identity. and as a result, we are left with gaping holes in our knowledge on LGBT health. From the small privately funded studies that have explored and collected data in this area, we have evidence that significant health disparities exist. For example, the Center for American Progress found that due to factors like low rates of health insurance coverage, high rates of stress due to systematic harassment and discrimination, and a lack of cultural competency in the healthcare system, LGBT people are at higher risk for cancer, mental illness, and other diseases, and are often found more likely to smoke or drink alcohol, use drugs, or engage in risky behaviors. The health disparities facing people who are both LGBT and members of racial or ethnic minorities are even more challenging. The federal government must have basic information on the health of all Americans in order to help address these issues, especially those who may face discrimination and stigma within the healthcare system. This legislation, H.R. 6109, would authorize HHS to collect, where practicable and appropriate, I want to emphasize those words, information on sexual orientation and gender identity for participants in health programs and health surveys. It requires the Secretary to develop standards for the development of questions and the appropriate and confidential collection of such information. And it also directs that this information be analyzed to assess disparities in health status and access to health care. Now, I'm aware that there may be some misconceptions about the bill, and I would like to help resolve those right now. First, there may be some who think that H.R. 6109 would require patients seeking treatment to answer questions on sexual orientation or gender identity in order to receive medical services. This is not true. Providing information is never a condition of receiving medical care, and it is certainly not in this bill. I urge my colleagues, and specifically you, Mr. Barton, to turn to page 2, line 21, where we explicitly state, and I quote, "Provision of information by an individual in response to a collection pursuant to subsection A shall only be on a voluntary basis." Further, the bill ensures that any data collected or not collected based on a decision not to provide information on a voluntary basis will not be used in any manner that adversely affects the individual that it is collected from. To be extra confident, we were including the strongest possible privacy safeguards in the Health Data Collection Improvement Act. And I'd like to ask my colleagues to review page 5, line 21, which applies the data collection requirements in current law for data on race, ethnicity, sex, primary language, and disability status. This is section 3101 of the Public Health Service Act. Secondly, I understand there are some who wrongly believe that this bill would require participants and perhaps children to divulge their sexual orientation or gender identity. This is also not true. Again, I urge my colleagues to turn to page 2, line 15, where it states data will be collected, quote, to the extent the Secretary determines appropriate and practicable. This means that we'll let the experts at HHS use their best judgment in determining which surveys or programs to amend. And I agree that it makes sense that we have to be absolutely age appropriate when we ask these sort of questions. But the bill leaves these decisions where they belong, in the hands of public health experts who have made similar judgments before. Finally, there may be some confusion about why this bill was introduced recently. It is true that H.R. 6109 is a new bill, but I assure my colleagues that our fight to include LGBT Americans in federal health programs and surveys is a long-standing one. In fact, the language in the bill before us today was taken from another bill that I author, H.R. 3001, the Ending LGBT Health Disparities Act, which I introduced in June of last year. I would have been pleased if we could have had that full bill before the committee today, but I was offered the opportunity to take this one section out for consideration today, and I simply jumped at that chance. I also want to stress to my colleagues that the language in the Health Data Collection Improvement Act is based on what was included in the House-passed health care reform bill. Let me remind you, this language was in the House-passed health care reform bill. So although it may seem new to you in this form, the language is essentially the same as what our committee and the full House of Representatives have already approved. And I'll wrap up by thanking HHS for reviewing the bill so carefully and closely. In testimony yesterday at our hearing, there was universal support for collecting this data. We are simply talking about getting information vitally needed to protect the health of all Americans, including LGBT Americans. Thank you, Chairman Waxman. Thank you, Chairman Pallone, for bringing this bill, and I yield back.
Thank you, Ms. Baldwin. I would, before we get to the amendments, why don't we just see if any other member wants to strike the last word? All right, we're going to go to amendments then. All right, Mr. Barton has an amendment.
Mr. Chairman, I do. I have an amendment at the desk.
The clerk will report the
number.
006 or 06.
Have copies. We'll pass them out.
Amendment to H.R. 6109 offered by Mr. Barton.
Without
Page
objection,
2.
the amendment will be considered as read, and the amendment will be passed out, and the chair recognizes the ranking member to speak on his amendment.
I appreciate the chairman's courtesy. I listened intently to Congresswoman Baldwin's support and defense of this bill. I also tried to follow, as she pointed to various pages in the bill, why this was not something that should be considered in a negative light. I would point out that on page 2 of her bill, or the bill, line 11, it says the Secretary shall is mandatory, shall is not voluntary. It is true that the actual submission of the data that she's indicated needs to be collected shall be on a voluntary basis. That's a true statement according to line 23 of the bill. But it's also a true statement that the Secretary of HHS, in consultation with the Office of the Civil Rights of the Department of Health and Human Services, shall develop standards and shall take into account and shall this and shall that. Now, if you're a citizen who's not conversant in the ways of Washington, and you walk into any health clinic in America seeking service from an HHS program, which is a lot of programs, and you get a form that's been developed by the Secretary of Health and Human Services, and you get a form that's been approved and developed by the Office of Civil Rights, you may not read the fine print that it's voluntary. If you're a young person, you may not even know what the questions refer to. And for the life of me, I cannot see, and I respect Mrs. Baldwin tremendously in her leadership on a number of issues, why this is something that the federal government should get itself involved with. So, in short, Mr. Chairman, this amendment that I've just put into consideration simply says that the Secretary shall not implement the provisions of this section until the Secretary can certify that the national deficit is zero. In other words, that we balance the budget. Because to do all the shalls in the bill is going to take quite a bit of staff manpower and quite a bit of effort that could be and should be used to do other things that actually improve the public health. We don't need to be taking hundreds, if not thousands, of government officials away from doing other things to help develop these standards and try to collect the data and implement in a way that is a positive. So I would urge the support of this amendment, and with that, I would yield back the balance
Mr.
of my
Chairman.
time.
Yes, a gentlewoman is recognized.
Mr. Chairman, first of all, I think it's fair to characterize the amendment as one that will prohibit implementation of this legislation for some time to come. So the question is whether you are for collecting data and getting knowledge about disparities facing the LGBT community or not. I think that's a clear choice before the committee in terms of looking at this amendment. But to get more, again, to the specifics of Mr. Barton's argument, we have federally funded health surveys. We're not talking about somebody going in to get their tonsils out or to get treated for a cold and being asked a battery of questions. We're talking about long-standing federally funded health surveys that ask information about race, ethnicity, primary language, disability status, sex, in order for us to gain information and insight on disparities that affect certain populations. But none of those federally funded surveys gather any information that would lead us to knowledge about disparities facing in healthcare delivery and healthcare outcomes facing the LGBT community. If we pass this amendment, we will defer that knowledge for an even longer time. This is really a gutting amendment. And the question is, do we want this knowledge so we can help fight for the best health care for all Americans so that we can end disparities against any subpopulation of Americans or not?
Well,
that's the clear question, and I would ask that we defeat this amendment.
Gentlelady, yield to me.
I would yield.
I thank you for yielding. I'd like to use this opportunity to inquire of Mr. Barton and anybody else on the Republican side. This amendment is clearly an amendment that would make it impossible for a very long period of time to ever implement the proposal. That's in my way the same way as just voting no on the bill. I don't know whether I don't look at that as an amendment that particularly offers an opportunity for compromise. You say you have other amendments? Could we know what those other amendments are? And the reason I'm asking is that we have votes on the House floor now. And if you have a lot of other amendments, we'll have to come back and consider those amendments. Perhaps we can know about those amendments now, and then we could see if there's any reason to see if there's a possibility of talking through these ideas before full committee.
Would the gentleman yield?
The time is with Ms. Baldwin.
Would the gentlelady yield then?
Yes.
Well, first of all, it's not an impossible task to balance the federal budget. We did it 3 years in a row in 1999, 2000, 2001.
Yeah, that's
only 9 years ago. So I would love to work with the current majority to come up with a plan to balance the budget. That if we could do that, it would be a small price to pay, I guess, to implement this bill. So, if you want to work on that, we're open. But as to other amendments, I'm not aware that we made a secret of the amendments. I think we turned them into the desk, and I certainly didn't authorize any kind of a subversive secret mission. I think Mr. Shimkus has an amendment. I think Mr. Pitts has an amendment. I may have one or two more.
The gentleman has the time, but I think that we're going to have to go to the floor, and we're not going to be able
to. But I would admit that there doesn't appear to be too much room for compromise on this particular bill, and so if we have to come back, I'm going to ask for a roll call vote on my amendment, and I would think Mr. Pitts and Mr. Shimkus would.
All right. If the gentlewoman has the time.
The gentlewoman would yield just to respond to the chairman.
I would be happy to yield.
I think, Mr. Chairman, we could move these amendments and vote them expeditiously now and be done without debate.
Before we go to the
Yep,
floor?
I
Because
do.
the votes have been called?
Yep.
All right.
All right. I agree with that on my side.
Okay. Does the gentlewoman yield back?
I yield back.
Gentleman yields back. All right. My understanding is that we have 3 votes, and we have 10 minutes left. Do you really think we can do this all in 10 minutes?
Well, Mr. Chairman, may I inquire?
I'm willing to have a show of hands I'm not willing to have a voice. I mean, obviously you have to have the voice vote first, but I would do a show of hands vote as opposed to a roll call vote if that would expedite.
All right. Is there any other discussion on the Barton amendment?
We might.
Okay. So we'll move to the Barton amendment. The question is on the amendment offered by Representative Barton. All those in favor, will you want to have a hands?
You can do it by show of hands if you'd wish.
All right. Well, then I guess can we just forego the ayes and nays and just have a show of hands? How does?
Note that Mr.
All
Weiner's
right. All
already
those in
voted
favor
yes.
will signify by saying aye.
Aye.
All those opposed will say no. All right. In the opinion of the chair.
Mr. Chairman, on that I ask for a show of hands.
All right. Well, show of hands. Clerk will have to explain how that works because I don't know.
You raise your hand.
All right. All those in favor, who are in favor, will raise their hand.
It's complicated. Raise your hand and she'll count.
All right. Do we have the number? How many?
Counted 39, Mr. Chairman.
All right. All those opposed will raise their hand.
Regular order.
I think they'd be just...
Will the clerk give us a tally on the hand vote?
Mr. Chairman, on that vote, the ayes were 11 and the nays were 12.
All right. So the amendment is not agreed to. Does any other member
Mr. Chairman, I have an amendment at the desk.
The gentleman from Pennsylvania, Mr. Pitts, is recognized. Will the clerk report?
What number of that is that amendment?
What's the number?
03.
Okay.
03? Thank you.
Clerk will report the amendment and pass it out.
Amendment in the nature...
Without objection, the
amendment
amendment
to
is
HR.
considered as read, and the chair recognizes Representative Pitts to explain the amendment.
Thank you, Mr. Chairman. This amendment would prevent the federal government from making sexual orientation or gender identity a health disparity. H.R. 6109, the Health Data Collection Improvement Act, would require patients seeking treatment at a community health center or a school-based health center or other entities affiliated with HHS-related programs to address questions on their sexual orientation and gender identity in order to receive medical services. Some believe that this data will be used to prove that sexual orientation and gender identity should be a health disparity population and thus allow the HHS Secretary to deem them as such. Provisions of the health reform law and many other bills pushed by our friends on the other side give preference to entities that serve health disparity populations, thus disadvantaging other groups not in those categories. This amendment would prevent the Secretary from deeming them a health disparity population and thus giving them preferences. With that, I yield back.
Does anyone else want to speak on the amendment?
Will the gentleman yield to me for a question?
Yes.
I could see that you would say that Secretary couldn't designate somebody as lesbian, gay, bisexual, transgendered by virtue of that being defining that as a health disparity population. Would your amendment preclude the Secretary from gathering data about those people in those categories having distinct health problems?
No, it would prevent them from being considered a health disparity, and thus
well, we don't say African Americans is a health disparity. We say it's a group, a minority group, and we want to get data on health impacts of that population. Same with Hispanics. So if you're saying that this wouldn't prevent gathering data, but simply says being homosexual does not mean you are suffering from a health disparity.
Well, they do have grant programs that say that if you're a member of a certain minority group, you are given preference. That's what we're trying to prevent.
Well, Mr. Chairman, I respectfully don't understand this and therefore would urge that we defeat it, because I think it could so broadly be interpreted as to defeat the whole purpose of the bill. So I would urge members to vote no.
All right. The gentlewoman from Wisconsin is recognized.
I just urge defeat of the amendment. It obviously, if we collect data that shows there are health disparities, we will want to address those.
Does anyone else want to speak on?
I would just say that the chairman's analysis is directly the reason why the amendment's being offered. Your analysis was right, and I yield back.
There being no further discussion, this time we're just going to have the show of hands. So all those in favor of the amendment by Mr. Pitts would please raise their hand.
Mr. Chairman, I want a roll call on this vote.
Unless someone objects, I'm going to move to a roll call. Okay.
Mr. Chairman, I think since we have a vote on the floor, if we're going to have a roll call, you're the one who said we're going to do it quickly.
I said we were going to do a hands on.
Let's have let's move to a roll call, and then we'll see what time we have left. The clerk will call the roll. Well, I'm told we have 6 minutes left. Is that going to be enough time to do a roll call? All right, we'll have the roll call.
Mr. Pallone.
Votes no.
Mr. Dingle. Mr. Gordon. Ms. Eshoo. Mr. Engel. Mr. Engel votes no. Mr. Green. Mr. Green, no. Ms. DeGette. Mrs. Capps. Ms. Schakowsky. Ms. Schakowsky, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Ms. Harmon. Mr. Gonzalez. Mr. Barrow. Mr. Barrow, no. Mrs. Christensen. Mrs. Christensen, no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes. Mr. Murphy. Mr. Murphy of Connecticut, no. Mr. Space. Ms. Sutton. Ms. Sutton, no. Mr. Braley. Mr. Waxman.
No.
Mr. Waxman, no. Mr. Shimkus.
Yes.
Mr. Shimkus, aye. Mr. Hall. Mr. Hall, aye. Mr. Whitfield. Mr. Whitfield, aye. Mr. Shattuck. Mr. Shattuck, aye. Mr. Blunt. Mr. Boyer. Mr. Pitts.
Aye.
Mr. Pitts votes aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mrs. Myrick, aye. Mr. Sullivan. Mr. Sullivan, aye. Mr. Murphy of Pennsylvania. Mr. Burgess. Mr. Burgess, aye. Ms. Blackburn. Mr. Gingrey. Mr. Gingrey, aye. Mr. Barton. Mr. Barton, aye.
Are there any other members who have not been recorded who would like to record their vote at this time? Okay.
On that vote, Mr. Chairman, the yeas were 11 and the nays were 12.
Tell me again.
The yeas were 11 and the nays were 12.
Okay, so the
Defeated.
Pitts amendment is not agreed to. Now, if there are additional amendments, which I believe there are, correct? We're going to have to come back, okay?
It's your call, Mr. Chairman.
Well, I mean, I don't think we have enough time. I don't want to jeopardize members' ability to vote. So we will... My understanding is Ms. Baldwin's willing to accept the parental consent amendment. Is that the only one left, or we have more?
That's the only one amendment left, and then the passage.
Well, then
Mr. Chairman, could I clarify?
Yes, the gentlewoman's recognized.
I had seen in advance the parental consent amendment and wanted to voice an interest in working with the minority. I think that is a valid concern. I do not think the amendment as presented is the way we want it in a final bill. I would say that minors who take health surveys, there is already parental consent language, and I think we should harmonize it. But I would be willing to work with the minority between today's markup and full committee markup to perfect and harmonize that parental consent language. That's the statement I would like to put on the record about that amendment.
And, Mr. Chairman, whose time is it? I'd like to ask for time from whoever. Is it the gentlewoman's time?
It's her time, but I would point out that the clock has run. I mean,
No, I
no,
just
I'm
want to
talking about on
respond
the
to her
floor.
offer.
There's no time left
Well,
on the
Mr.
floor.
Chairman, let the gentleman from
Sure.
Illinois
The
make
point
a
is,
statement.
it's my amendment. I'd gladly accept her offer to work with it if this gets wrapped into the bill, and then we can work afterwards, and I would go on a voice vote on this amendment. We will have a recorded vote on passage, though.
Yeah. Mr. Chairman, I ask unanimous consent that the amendment that Mr. Shimkus is going to offer, which has been at the desk, on parental consent be considered as adopted by the subcommittee.
That's an unanimous consent request?
Yeah.
All right. Without objection, so ordered.
Mr. Chairman, I now ask unanimous consent that we proceed to a roll call vote on passage.
All right. Unless anyone has objection, the clerk will call the roll.
Mr. Pallone.
Yes.
Mr. Pallone, aye. Mr. Dingle. Mr. Gordon. Ms. Eshoo. Mr. Engel. Mr. Engel, aye. Mr. Green. Mr. Green, aye. Ms. DeGette. Ms. Capps. Ms. Schakowsky. Ms. Schakowsky, aye. Ms. Baldwin. Ms. Baldwin, aye. Mr. Ross. Mr. Weiner. Mr. Weiner, aye. Mr. Matheson. Ms. Harmon. Mr. Gonzalez. Mr. Barrow. Mr. Barrow, aye. Mrs. Christensen. Mrs. Christensen, aye. Ms. Castor. Ms. Castor, aye. Mr. Sarbanes. Mr. Murphy of Connecticut. Mr. Murphy, aye. Mr. Space. Ms. Sutton. Ms. Sutton, aye. Mr. Braley. Mr. Waxman. Mr. Waxman, aye. Mr. Shimkus.
No.
Mr. Shimkus, no. Mr. Hall. Mr. Whitfield. Mr. Hall. Mr. Hall votes no. Mr. Whitfield. Mr. Whitfield, no. Mr. Shattuck. Mr. Blunt. Mr. Boyer. Mr. Pitts. Mr. Pitts, no. Mr. Rogers. Mr. Rogers, no. Mrs. Myrick. Mrs. Myrick, no. Mr. Sullivan. Mr. Sullivan, no. Mr. Murphy of Pennsylvania. Mr. Burgess. Mr. Burgess, no. Ms. Blackburn. Mr. Gingrey. Mr. Gingrey, no. Mr. Barton. Barton votes no.
Any other members who wish to be recorded that haven't been recorded? If not, the clerk will call the roll.
You want the results?
Yes.
On
I'm
that
sorry.
vote, the final passage, the ayes were 12, the nays were 10.
And the bill is then forwarded favorably to the full committee. I'd ask unanimous consent that staff be authorized to make any technical and conforming corrections to the measures forwarded at today's markup, and without objection so ordered. Let me thank again both the staff of the majority and minority and our ranking members for all of their cooperation on today's markup. I think it was very successful. And there being no further business before the subcommittee, without objection, the meeting of the Subcommittee on Health is adjourned.